The NHS is under pressure to reduce the nation's medical bill by £300 million by 2021, meaning solutions must be introduced to help manage costs whilst maintaining high-quality patient care. NAPP Pharmaceuticals say one solution could be with biosimilar medicines, a sustainable healthcare initiative that offers biologic treatments highly similar to original medicines, providing the same level of treatment and care, but with the potential to reduce costs. Julie MacDonald explains.
For thousands of patients, access to life-saving and life-enhancing treatment can be limited due to the high cost of biologic medicines.
So could introducing biosimilar medicines, which maintain the quality, efficacy and safety of their originator medicines, give hospitals an unparalleled opportunity to cut costs without diminishing patient safety and care? Paul Schofield is Medical Director at NAPP Pharmaceuticals, and he explained to me that as some of the NHS's most expensive and widely used biologic medicines come off patent, they can be replaced by much less costly biosimilar medicines, which are as effective in treating conditions like cancer, diabetes and rheumatoid arthritis.
The top 10 medicines in the NHS that cost the most in the NHS, 6 of those 10 are biological medicines. If you could save 60% of that top 10 price, not only could you save the money to the NHS, which the NHS estimate I believe is about, they're looking for something like £300 million per year. For me it's like about £6 million a week the NHS could save. And what could you do with that money? So more patients could be treated earlier in the disease process. You could release those savings to treat other conditions.
There's no clinically meaningful difference between originator biologic medicines and biosimilars. They're rigorously tested and checked for quality.
The discussion around, is it a second-class citizen or is it an inferior product? And the reassurance I want to give to those clinicians is, no, it isn't. There's very sophisticated technology applied to approval of a biosimilar medicine, highly complicated, highly complex, but that reassurance to have no clinically meaningful difference, that's really key to understand that.
At the Royal Marsden Hospital in central London, a saving is already being made of tens of thousands of pounds each month by investing in biosimilar medicines. Its chief pharmacist Jatinder Harchawal told me how and why the hospital made the decision to opt for biosimilars.
Being in a specialist cancer hospital, we've started using biosimilar rituximab. So we've made that switch over the last 3 months and we're using it in all of our lymphoma patients. So the process has been fairly seamless for us because part of my role working for the Royal Marsden has also been supporting the Cancer Vanguard. And the Cancer Vanguard involves the Royal Marsden Hospital, University College London Hospitals and the Christie in Greater Manchester. And together we've tried to produce a consistent approach to adopt and use biosimilars in oncology. So we focused a lot on getting the education right. We produced education material through the Cancer Vanguard that was shared with all of the hospitals. And actually we've made that available on a centralised website through the Cancer Vanguard that now anybody in the country can use.
Developing education and guidance is key to supercharging the uptake of biosimilars across the country.
As BOPA chair, we realised that this was going to be a big challenge that our members would face, and there was very limited guidance available. So we developed some good practice guidelines on successful implementation to support our members and also support the wider NHS agenda. One thing that we found with biosimilars is this has seen a lot of partnership working. In all, it's been a good experience of everyone working together for the greater good of the NHS.
Although the market for biosimilars is still evolving in the UK, the understanding of these medicines is improving, and best practice in areas of medicine with more experience in using them is starting to create momentum.
Once clinicians know that the medicine does exactly what it says on the tin, then that drives momentum very quickly. I think at the same time as that's been moving, you've had the NHS policymakers set quite clear objectives and goals for what percentage of the biologic should be written or prescribed as the biosimilar. But there are things that can be learned from the gastro, oncology, rheumatology community that would be helpful to medics in those other areas. So I think it's just a learning curve.
So biosimilars are becoming an increasing reality, offering major savings to the NHS for the next 5 years and beyond. And for patients and clinicians, that means more potential for access to genuinely innovative and effective high-cost medicines.